Sjogren syndrome is a chronic autoimmune disorder characterized primarily by the body's immune system attacking its own moisture-producing glands, leading to dry eyes and dry mouth. It can also affect other parts of the body, including joints, skin, and organs. Overview. Type: autoimmune disorder. Prevalence: affects an estimated 0.1% to 4% of the population, with a higher prevalence in women, especially those aged 40 and older. Primary versus secondary. Primary Sjogren syndrome occurs independently without any associated autoimmune diseases. Secondary Sjogren syndrome occurs alongside other autoimmune disorders, such as rheumatoid arthritis or lupus. Causes. The exact cause of Sjogren syndrome is not fully understood, but it is believed to involve a combination of genetic, environmental, and hormonal factors. Triggers may include genetic predisposition. Certain genes may increase susceptibility to autoimmune disorders. Viral infections. Some infections, such as Epstein-Barr virus or cytomegalovirus, may initiate or exacerbate the syndrome. Hormonal factors. Since the condition is more prevalent in women, hormonal influences are suspected to play a role. Symptoms. The hallmark symptoms of Sjogren syndrome are dry eyes and dry mouth, but the condition can present a wide array of symptoms, including dry eyes, xerophthalmia, burning, itching, or a gritty sensation in the eyes, increased sensitivity to light, difficulty wearing contact lenses, dry mouth, xerostomia, the dry, sticky feeling in the mouth, difficulty swallowing or chewing, increased dental cavities or oral infections due to decreased saliva, joint pain and stiffness. Many individuals experience arthritis-like symptoms, including joint pain and inflammation. Fatigue. Chronic fatigue is common and can significantly impact daily life. Dry skin and vaginal dryness. Skin may become dry and scaly, and women may experience discomfort during intercourse due to vaginal dryness. Other organ involvement. Sjogren syndrome can affect various organs, leading to additional symptoms such as lung involvement, cough or difficulty breathing, kidney issues, altered kidney function, neurological symptoms, numbness or tingling, liver or pancreatic involvement, resulting in jaundice or digestive issues. Diagnosis. Diagnosing Sjogren syndrome typically involves a combination of clinical evaluation, laboratory tests, and imaging studies. Medical history and physical examination, discussing symptoms and examining the eyes, mouth, and joints. Blood tests, to check for specific antibodies that are commonly associated with autoimmune disorders, such as anti-nuclear antibody and common in various autoimmune diseases. Anti-RO/SSA and anti-LA/SSB antibodies, specific to Sjogren syndrome. Erythrocyte sedimentation rate (ESR) and C-reactive protein (CRP) indicators of inflammation. Salivary gland tests. Coelography, imaging of the salivary glands to assess function and blockages. Salivary flow test, measures the amount of saliva produced. Eye tests. Schirmer's test, measures tear production. Ocular Surface Disease Index (OSDI), a questionnaire assessing eye symptoms. Biopsy, a minor surgical procedure to take a small sample of tissue from the salivary glands or lip, which can show inflammatory changes characteristic of Sjogren syndrome. Treatment. There is currently no cure for Sjogren syndrome, so treatment focuses on relieving symptoms and managing complications. Dry eyes. Artificial tears, over-the-counter lubricating eye drops to relieve dryness. Prescription eye drops, such as cyclosporin A Restasis or lifitegrast 12 to increase tear production. Dry mouth. Saliva substitutes, mouthwashes and gels to alleviate dryness. Medications, such as pilocarpine Saligen or phenylene evoxate that stimulate saliva production. Joint pain. NSAIDs, non-steroidal anti-inflammatory drugs for pain relief. disease-modifying antirheumatic drugs DMARDs such as methotrexate or hydroxychloroquine for joint inflammation. Systemic symptoms: corticosteroids, for severe inflammation or organ involvement. Immunosuppressants, for managing more severe autoimmune manifestations. Lifestyle modifications. Hydration, staying well hydrated and using humidifiers to alleviate dryness. Dental care, regular dental check UPS to manage oral health issues due to decreased saliva. Complications: individuals with Sjogren syndrome may face several complications, including increased risk of infections due to dry mucous membranes in the mouth and eyes. Dental issues, increased risk of cavities, gum disease, and oral infections. Lymphoma, the higher risk of developing certain types of lymphoma, particularly mucosa-associated lymphoid tissue malt lymphoma. Organ damage, long-term inflammation can lead to damage in organs such as the kidneys, liver, and lungs. Prognosis: the prognosis for individuals with Sjogren syndrome varies widely. Many people can manage symptoms effectively with treatment and lead relatively normal lives, while others may experience more severe complications. Regular follow-up with healthcare providers is essential for monitoring and managing the condition. Conclusion: Sjogren syndrome is a complex autoimmune disorder that significantly impacts the quality of life due to its various symptoms and complications. Early diagnosis and a tailored treatment approach are essential for managing symptoms and preventing complications. Individuals experiencing symptoms of dry eyes or dry mouth should consult a healthcare provider for a thorough evaluation and appropriate management.